Hello, I am Dr. Gurava Reddy, Chief Joint Replacement Surgeon and Managing Director of Sunshine Hospitals, Hyderabad. Today I am going to talk to you about mobile bearing knee replacement surgery. How a mobile bearing knee is different from a fixed bearing knee. What are the advantages and disadvantages? Before we go any further, we all know that knee replacement surgery is the gold standard treatment for advanced osteoarthritis of the knee joint. There are 4 stages of arthritis in the knee, and first 3 stages you can manage with tablets, physiotherapy, and taking care of the knee joint. But when it happens into the last stage, surgery is the only answer, and that is a total knee replacement. That means we will cut the worn out parts and put a new joint which is like this. So that is the knee replacement surgery. But there are different ways of knee replacement surgery. Today I am going to talk to you about mobile bearing total knee replacement. Mobile bearing is a concept developed long back, almost 30 to 40 years back. There is a popular orthopedic surgeon called Buccal, and he has got a bioengineer friend called Papas. So Buccal, Papas, they developed this knee long back in New York, and that has become popularized over the years, and it is one of the knees having the longest follow-up in knee replacement implants. I am very fond of this implant because this gives excellent results. Buccal Papas or mobile bearing knee is good in the sense it is highly congruous. First of all, I will show you the difference between a fixed bearing and a mobile bearing knee. Fixed bearing knee means the tibia plus plastic or polyethylene is fixed to the tibial base plate, so it won't move anywhere. So that is called fixed bearing. Whereas a mobile bearing knee, the polyethylene will keep on moving on the tibial base plate. So the advantage is when you put a new joint, it can give a rotation also like this. So that means it imitates almost like a normal knee, because normal knee is just simply not bending. There is a small rotation also at the extremes. So in other words, the mobile bearing knee can give rise to these rotations also. So that's why it is more anatomical than the fixed bearing knee. Another thing is it is very highly congruous. That means this curve and this curve will be matching. So you can have a deep flexion. That means joint can bend up to 130 to 140 degrees. Another important point is when you have a deeply congruous joint, that means the stress on the bone will be less compared to the fixed bearing. So these are the 3 advantages of a mobile bearing knee replacement surgery. So the technique wise, the mobile bearing knee has to be done more precisely than fixed bearing knee, because if you don't balance the ligaments properly, sometimes this polyethylene can rotate extremely and sometimes it can come out. That's what we call spin out. So in other words, mobile bearing knee needs a proper balancing. Mobile bearing knee, the bending will be more, the rehabilitation will be quicker, and the patient feels better for subjectively. If I put fixed bearing knee on one side and mobile bearing knee on another side, and if I ask patients which is feeling better, they tend to answer that the mobile bearing knee feels natural and feels stable and feels comfortable. So that is the advantage of the mobile bearing knee. So the technique wise both are the same. Only thing is mobile bearing knee, we got to see that the joint is, the tibia is cut very properly without any slope, and the ligament balancing should be right. Post-operatively the same, both knees can move out same way, and on the day 1 they walk, and in day 3, 4 the mobile bearing knees can bend right up to 130 to 140 degrees. So as I said, the long-term results of both fixed bearing and mobile bearing knee are equally good, I should say excellent. But my personal choice is mobile bearing knees, highly congruous knees, and in that Buccal Papas knee is one of the best knees I have done in my life. So any joint to be successful, the ligament balancing should be good, the alignment should be good, and the surgeon who is doing the procedure should be adequately experienced. Otherwise, inexperienced surgeon in a small setup will create a lot of complications in joint replacement surgery, especially infections and malalignment. That means the joint will not be aligned properly and there will be a lot of problems. So all the patients in stage 4 arthritis, you can avail the opportunity of getting a knee replacement done, and probably mobile bearing knee is one of the choices, and get the operation done and have a rebirth and enjoy the life to the full. There is no age limit. You can do right up to 90-95 years. The oldest patient I operated is 95, still playing tennis in Secunderabad club. So age is not a bar. So get up and going and get the knee replacement done, and you will have an excellent results, and that's almost like a rebirth. Thank you.